Today we have with us as Dr. Garima Singh. She has secured All India rank of 712 in NEET PG 2024, and she is here to discuss whatever she has learned during this journey. So, Dr. Garima, please introduce yourself.
I'm Dr. Garima Singh. I did my MBBS from BMMC and Safdarjung Hospital, New Delhi. And I am from 2017 batch. So I took a drop of 1 year. And most reason for the drop was because I wanted to take care of my mental health. Because while working in internship and doing the NEET PG preparation, it was pretty hectic for me. So I decided to take an year gap and then give my NEET PG exam. So I wasn't prepared in 2023 NEET that I gave, and my mom forced me to give the exam. So I guess I got 90,000 rank at that time. So after coming back from after coming back from internship, I started my preparation in I guess May 2023, and I didn't give the INICT that year. I gave directly the November INICT. In that, I had 10,000 rank. I didn't prepare well at that time. I was just doing my first revision when the exam happened. And after that, there was a lot of postponements and everything. But the main focus of mine was to focus on my mental health and to be as stable and as sane as I could be, because in the last day of exam, it's all about how well you perform on that day in those 3.5 hours. It's not about the preparation, it's about the day, how calm you are and how less mistakes you do.
Great, great. So, how was you like in professionals? Were you a topper kind of, or you are a mediocre student?
When I got into MBBS in BMMC, my All India rank was 130. So I was at that time, yes, I was a topper, but uh, in my first professional, second professional exams, it was fine. In my final years, I got distinction in pediatrics. So, while coming towards the end of the course, yeah, I started getting back into my zone of studying.
Okay, great, great. So, we were in a top 10% of the class, I guess.
Could be I actually never figured it out, but yeah, could be like overall after the percent like overall percentage if we are calculating.
So, how was it in your internship? You said that it was a lot hectic and it affected your mental health. How it affected your mental health, and what did
No,
it?
no, no. Mental health wasn't affected by internship. It was like I needed a break for a very long time because I have been living in hostel since ninth standard. So I needed to stay at home for a year because it's been a very long, like 9, 10, 11, 12, then 6, 5.5 years, and like half more year due to COVID. So it was almost like 10 years since staying away from home. So I needed to stay at home. But internship at Safdarjung, obviously, like a tertiary care hospital in New Delhi, it's super hectic. Like we used to have 24-hour duties, 14 hours duty continuously, day and night off. So yeah, I just thought I need to just finish my internship. That's the first priority, and then I'll start studying. Because doing both, like last year, the NEET PG topper was from my batch only, Arushi Narwani, and she did her internship and she did study it. So everyone has their own way to do it. Mine was, I'm going to take a break.
Okay, great, great. So, what were your sources of your preparation? Which books you referred, or which coaching notes you referred?
My basic was Marrow because I watched the Marrow videos while I was in third year and final year. So for third year and final year subjects, I watched Marrow. But when I actually started studying BTR of Xanavora map was like the core thing that I did, because she used to give us the schedule and then she used to take the test. So that was like that would keep you in a track. If you are doing this much, then you are on the right track. So by the end of everything, it was Zainab ma'am and BTR.
So, you relied totally on BTR.
Not completely. I did my rapid revisions and for final year subjects like obs, gynae, surgery. I studied from rapid revisions of Marrow, and I studied path and micro from Preeti ma'am of Prep Ladder, and anatomy from Ashwini sir. So there were various sources, but I said, Zainab ma'am kept us on the track. You have to follow the schedule. You have to do this much. If you are doing this, if you are scoring this much in the score, and the T&D, matlab, exam and discussion that she used to take, that was a major game changer because she used to give proper clinical based USMLE pattern questions, which helped a lot of students in the, matlab, like I had the evening shift in NEET PG this year. So the most of the questions were very based and long question, lengthy questions, which I thought I got benefit because I used to practice Xanogram.
Okay. Actually, video is lagging a lot. Is it mobile data or Wi-Fi, broadband?
No, no, it's Wi-Fi, but is it lagging a lot? I can try connecting from my mobile.
No, no. Broadband
Just a second.
would have higher speed. Na? So I don't know how in your
Yeah,
it is working because it is getting a lag. You just re-log in.
is it better now?
Yeah, yeah. Now it is better. So we were talking about BTR, na? So sources, yeah.
Yeah.
Yeah. So what were your sources like?
Basic was question bank from Marrow, GTs from Marrow, rapid revisions of final year and third year subjects from Marrow. And then I did anatomy from Ashwini sir, Bhatia, and path and micro from Preeti ma'am, Prep Ladder, and also physiology from Somen Manna sir, Prep and Ladder. And then overall, it was BTR, doing BTR and revising everything that was in BTR because in last 10 days, you have to revise the thing that you have already studied. So BTR was the core source. I used to just add the few things that were missing here and there and doing the GTs. Majorly, my preparation was based on doing the questions, matlab MCQs. I almost, by the end of the preparation, I used to do 300, 400 MCQs per day because reading, going through notes was very difficult for me because attention span or it got boring after 2, 3 reads and after so many postponement, it was very difficult. So just to keep the interest going, I used to solve MCQs more.
Great, great. But you, as far as I can comprehend from what sources you referred, you took the best of all the institute and studied from the
Yeah,
and that's really a good technique because do not stick to one sources. Whatever best you are getting from different sources, you should go and study from there. So you said you
yeah, exactly.
yeah, yeah, you can speak.
You were asking.
Yeah. So when which shift your evening shift was the exam? So how much you attempted?
Yeah, I attempted 191 questions and out of that, I got 166 correct and 25 wrong.
Okay, great. So that totals to
Um, I have to see. I didn't see the exact marks. Just give me a second.
okay, okay, fine, fine, fine. So
I guess 639, 639, 640 around.
so how were your GT scores like? I mean, like this only or
Yeah, almost very similar, like getting 166, 167 correct. The highest I ever got correct in my GT was 171. So, and rest of the GTs that I used to give, it was like around 165 to 170 correct. So, almost approximately around this.
okay? So kind of your marrow performance mirrored the actual performance.
Marrow also, I used to give cerebellum GT also. I used to give preplatter GT also. So GT I used to give every platform जहाँ पे भी free होता था, I used to give.
Okay, so what was the frequency like giving GTs?
When I started studying, in my first read, I used to give GT once per month. Then after my second and third read, I started giving it twice a month, like every 15 days. But later on, after I completed my revisions and everything, it was like at least one GT a week. But like as I said, after postponement of June till August, it was like I used to give two GTs, three GTs even in a week because I couldn't like go through the pages and notes. So I was like, I'll give the GTs, I'll do the opposite revision. Like the question that I'm getting wrong, I'll go through the notes of that topic that I'm getting wrong, and then just if I'm seeing any topic that I'm frequently getting wrong, then correcting it or rectifying it instead of just going through monotonously through the notes.
Okay, so what was your rank in May INI 2024?
It was 3,000 something.
So what you did in between that? There was so much jump in NEET PG.
Mm, I don't know. Maybe because like when I gave the May INICT, I actually couldn't do the complete revision that I had thought in last 7 days, which like I couldn't plan it properly. Like all the things that I needed to go through, I didn't. And there were a lot of silly mistakes that I did in May INICT. And those questions still haunt me in my dreams that I did a silly mistake. So I made it a point that no matter what happens in NEET PG, I'm not going to do those silly mistakes that are going to haunt me in my dreams. So yeah.
So definitely right now you would be getting sweet dreams.
Still there are nightmares that maybe शायद नीट पीजी नहीं हुआ है अभी रैंक नहीं आई है शायद फिर से पढ़ना पड़ेगा शायद पोस्टपोन हो गया this keeps on happening.
Okay, okay. So, how did you study? Was it a group study or you studied?
No, I studied at home. I studied on my own. My parents live in Odisha, so I am currently in Odisha, and I stayed here for after my internship for 1.5 years now almost. My internship ended in April, so I stayed here at my home and I studied at home.
Okay, so what branch would you be taking?
That's actually a very difficult question. Wanted to take psychiatry as a branch because I was very interested in psychiatry, and I just feel we need good psychiatrists in our country because like people need good psychiatrists who are non-judgmental and to whom they can go and talk. But right now, my parents are not agreeing at all to take to let me take psychiatry. And it's I don't know. I'm not very sure. I'll go. I'll talk to my seniors. I'll talk to my professors what they would suggest. And overall, because I just want to take a branch that doesn't take it's not too taxing on me. Like with time because I need my personal life. It's not like I can because like if I take medicine, it's like in Safdarjung or RML, the places I would prefer. There are 48 hours continuous duty, 72 hours continuous duty, and that's very taxing on your health and everything. So I would want a branch that is more that would give me a little bit of my personal time. Let's see. I don't know. I'm not very sure. Maybe I'll end up taking medicine. So let's not say that.
Okay, right now you have dropped the idea to become a good psychiatrist. Now, right now you would be thinking good radiologist countries also need.
I don't know. I want. It's just I can't fight my parents so much for next 3 years of my residency. Um,
Okay, it's almost same for all the children, I guess. Whoever because you are in the medical in the first place, you have been listening to your parents. That's why you are in this.
yeah, probably, and because it's I'm the first doctor in my whole entire family, so it's being the first doctor. Please don't take psychiatry and everything. That kind of stuff in the family is also going on. I
Yes,
don't know what to do.
and you will get clearer picture as counseling comes. So
Yeah.
you studied, you were outside your house from ninth class. So were you in a boarding and where?
Yeah, I was in boarding school in 9th and 10th standard in DPS Pillai, Chhattisgarh, DPS Risali. And then in 11th, 12th standard, I was in Kota in Allen. And then after that, college. Matlab 5.5 years. COVID did it to 6. So, yeah.
Okay, great. So right now many aspirants would be preparing for INI number and also for
Yeah.
need. So what message would you like to give them to them?
Keep doing questions. Questions are the main thing because it will clear your concept and make you practice it. Keep you calm. Keep giving GTs because in the end you have to give an exam. You just don't have to matlab, go through the notes. You have to know how to solve the question and keep your mental health safe. That is the most important message because a lot of people, because of so many of postponements here and there, they got so distracted and like even my friends, they just start spending time here and there or something like that. Just don't do that. Like, this is the first and last time you're preparing. Do it well. Don't lag behind it just because NMC can't do its work properly.
Okay, okay.
Yeah.
Great. So you said giving lot of GTs. So there might be some GTs where you did not get your desired rank, or so. Were you demotivated at that point of time, and how you motivated then?
I very honestly, I never took GT as my like testing thing. I used to just give GT so that I could learn new things, the things that I'm lagging behind. I never used to test myself with GT. Like to be honest, the first GT that I gave, I actually just got 100% correct out of 200. So that was the first GT that I gave. And I was so sad. I talked to one of my friends. She's doing obs gynae in Sabdachang only. So she was like, Garima, GTs are not to test yourself. GTs are just to give and learn. You don't have to test yourself. You don't have to do. You just have to know how to solve the question in 3.5 hours. That's for time practicing and learning. Nothing about score, nothing about rank. Never ever see your score or rank.
Okay, great. But your rank in the GTs and in the NEET PG were kind of similar. So
Yeah, very similar.
so would you like to add anything from your side? Because I think I have asked what I could ask. If you can add anything, it would be good.
I would just say you need to make last 7 or 10 days revision thing very seriously, that what all you have to revise and how all you have to revise, because that was a mistake that I did in May INICT, that I didn't make that 10 days count as much as I should have. So just like whatever you read in the entire year or 6 months or 3 months, whatever, you just need to know how to revise it in like last 10 days. Because if you don't revise it in last 10 days, most of the things you will know, but you will get confused between two options and then it will be a chaos. And once you start getting confused in the exam, it मतलब affects your mental health. Like during the exam, it's like कि यार ये भी नहीं आया, next question भी नहीं आएगा, शायद अगला question भी नहीं आएगा. तो you shouldn't do that in exam. And also while giving the exam, I would say never ever think how your exam is going. अच्छा जा रहा है, बुरा जा रहा है, बहुत अच्छा जा रहा है, कुछ नहीं सोचना है. Just be in Zen mode. You don't care how the exam is going. Just one question at a time. You don't remember the past question. You are not caring about the future question. Giving a good exam is as important as the preparation.
Okay, you're true Zen ma'am student talking about Zen and all things.
Yeah, yeah. I'm a BTR fangirl, so very honestly, it can't help that.
Great, great. So, Garima, it was nice having you on my platform, and best of luck for my side. And may you earn everything you desire. And
Thank
best.
you. Thank you so much.
Hey guys, thanks for watching this YouTube video, and make sure you subscribe to my channel so that you are able to win cool prizes. And right now, in your mind, you would be thinking, what cool prizes would be I would be awarding? Just think of anything that I should give to you. And that cool prizes, surprise, that there are no prizes and it's a free YouTube video, and you want free things over the top of free things. You greedy people, just subscribe, man. It takes a lot to make such kind of videos for you so that you take motivation from these people's journey and use it for your own benefit. So please do share and subscribe and comment. It helps a lot in the growth of the channel and also provides me a motivation to continue such good work. Thank you.